Welcome, everyone, and thank you for joining us for Resiliency and Burnout, diving deeper into cortisol and the cortisol awakening response, presented by Dr. Kerry Jones. I'm Dr. Paul Herkel, and I will be your host for today's presentation. Before we get started, I'd like to go over a few housekeeping items. There will be a Q&A session at the end of the presentation, time permitting. If you'd like to ask a question, you can do so throughout the presentation by typing it into the question box in the control panel at the right of your screen. We'll be answering it throughout, and then we'll also be asking Dr. Kerry for her input at the end. Please note that this presentation will be recorded for future distribution, and it will be available at aor.ca. Finally, since this is our first healthcare professional exclusive webinar of the year, and Dr. Jones is our guest, it's the perfect time to announce a very exciting and the topic is on the neuroendocrine connection, how do hormones affect the brain and nervous system. Dr. Jones will discuss the influence of hormones on brain function. I will be speaking about the interventions to address neuroinflammation. To sign up, stay tuned to invites from both AOR and Precision Analytical, and AOR is launching its new pro-exclusive website, which is where you'll be able to sign up, so stay tuned for that. That should be launching sometime in early February. So now on to our presentation and guest speaker. Dr. Kerry Jones is an internationally recognized speaker, consultant, and educator on the topic of women's health hormones. She graduated from the National University of Natural Medicine, which is in Portland, where she completed her 2-year residency in women's health, hormones, and endocrinology after graduating from naturopathic medicine. She's the medical director for Precision Analytical, as I mentioned, the creators of the Dutch hormone test. Thank you for your patience, and now we're ready to begin. So I'll turn over to Dr. Jones. Welcome, and thank you so much for joining us today.
Thank you so much, Dr. Herkel, and thank you to AOR for sponsoring this, because I'm really excited to talk about resiliency, burnout, diving deeper into cortisol and the cortisol awakening response. And I really want you to understand how important the cortisol awakening response is to your health, and what it does for all sorts of symptoms and all sorts of conditions that I think you're really going to recognize as we go through this. So let's get started. So as Dr. Herkel said, I am the medical director for Precision Analytical, but what we're really going to talk about is the cortisol awakening response. My entire objective is very simple. I am going to help you understand the importance of a healthy cortisol awakening response and how straightforward it is to address. I want you to be able to address this starting tomorrow morning. So let's cover the basics so that I know that you know we're on the same page. We're going to look at the Hpa axis. That's where we're going to live for the next 90 slides. So with the Hpa axis, we know that the hypothalamus releases CRH, the anterior pituitary releases ACTH, and then of course we get all of our hormones. Now we're focusing on cortisol today, but in this circle are your catecholamines, norepinephrine and epinephrine, which we know are more part of your sympathetic. The release is due to a sympathetic stimulation. But cortisol is what we are focusing on. So if we zoom in, let's zoom in on the adrenal cortex here. And first thing, I want you to see how thick the adrenal cortex. This is actually sort of drawn true to form of how big the cortex is in relation to the whole adrenal gland. And then we're going to zoom in even more on the zona fasciculata. That's where you make cortisol. So as a little reminder, your glomerulosa, which is small, makes aldosterone. And then your reticularis is where you make your DHEA, DHAS, and other androgens. So with cortisol production, 70% of the entire adrenal cortex is the fasciculata. That's how important cortisol production is to the body. When you produce cortisol, less than 5% is circulating as free. Please remember, it's the free hormones that bind to receptors and do the things. The rest of it is bound up primarily to cortisol binding globulin and a little bit to albumin. Cortisol binding globulin is known as CBG, also known as transcortin. Cortisone, which is the inactive form of cortisol, also circulates and also binds to cortisol binding globulin. Now, we won't be talking about cortisone today, but cortisone is really, really important because cortisone is what your body will flip cortisol to when you're trying to protect the mineral corticoid receptors. So it is a very important hormone. When you get stressed out, when you get in sort of a stress situation, it takes about 10 minutes for cortisol to get made and released. It's not immediate. It's your catecholamines that are immediate. So when you get a stressful test or a text message, or you're about to get, in a car accident, you have to swerve really quickly, something stressful comes up at work, that's your catecholamines talking. But cortisol is really important, and it comes a little bit later. Now, it stays around longer. The normal half-life with a healthy liver is 1 to 2 hours, depending on research. This is your normal 4-point collection. Everyone has seen this. This is not new. You do the first collection in the morning, you do the first collection 2 hours later to, around lunchtime, depending on the lab. You do it in the afternoon or around dinner, and then you do it before bed. And what you're trying to see is that general broad sweeping circadian rhythm. But it misses sort of the point of resiliency. What is resiliency? There's a lot of really cool research coming out of the Netherlands where they talk about endocrine resiliency, metabolic resiliency, and basically resiliency is you have the flexibility or adaptability to survive your environment. And so I used to call this the trampoline effect back in the day. I used to call this when people would say to me, why can I not feel as energetic as I used to? Why can I not handle stress like I used to? And I would call it the trampoline effect, that when you were younger and you were more resilient, you used to bounce on your trampoline and, stress would happen or sickness would happen, and then you could bounce right back up into the world and be fine. But over time and over, multiple assaults on the body and in the body, whether it's from infections or inflammation or just stress or chemicals or whatever it is, mental, emotional, then our trampoline gets thinner and thinner and thinner. The coils aren't as bouncy as they used to be, and we don't have the adaptability, the flexibility, the bounce to get back up there again. Turns out endocrine flexibility is what they're calling it. It actually has a much better name than the trampoline effect. And what they're saying is rapid endocrine flexibility is a crucial component of an appropriate response to dynamic environments. And we live in a dynamic environment, right? Especially when the environmental changes that demands an endocrine response that is stochastic, which means able to adapt. Responding appropriately to changing conditions is crucial in dynamic environments. Individual variation and the flexibility of physiological mediators of phenotype may influence the capacity to mount an integrated response to unpredictable changes in social or ecological context. Basically, what they're saying is, do you have the flexibility, the adaptability, not only to change and adapt to your environment, what's going on, but at what speed can you do it at? Because the faster you can do it and the better you can do it, the more you're able to thrive in your environment. So let's take an acute stress situation. You have a mild acute stressor. You get a sympathetic stress reaction, right? You get the catecholamine release, you get a cortisol release, you get the parasympathetic rebound, and you return to normal. The blue line is on pars when it first originally happened. Over time, though, chronic stress response, you get the stressor that's ongoing or multiple stressors that keep coming. So maybe the original stressor is over, but you just keep getting hammered with stressors, no matter what it is, inside the body, outside the body, actual stressors, imagined stressors, mental, emotional, infection, it doesn't matter. You get this strong sympathetic stress response. And unfortunately, you don't really get the appropriate adaptive response to heal and to recover, and you fail to recover to normal. And so many of our patients, and really honestly, so many of ourselves that are listening, know and feel the failure to recover to normal. People just say, I don't feel as resilient as I used to. I don't feel as able to adapt as I used to. So like I said, the less flexible the whole body system is, the whole body system, not just, one gland, the whole system, or the slower the system is to adapt, the less able to survive and thrive in your environment. So you're going to start hearing a lot about endocrine flexibility, metabolic flexibility, phenotypic flexibility, and this is where the cortisol awakening response ties in. This is why I'm making such a big deal out of this, because the cortisol awakening response is supposed to occur in the absence of any apparent stressful situation or imminent danger. The cortisol awakening response in the morning is supposed to be a natural part of getting your butt out of bed and getting you ready for the day. But in some people, it doesn't occur like it's supposed to, which is why I have there, well, it's supposed to occur. And it can really affect resiliency and flexibility. So now when it comes to a lot of research into this area, they're saying that The car could be a result of anticipated demands of the upcoming day, stress anticipation, and could support coping with daily life stress. The better and healthier cortisol awakening response is, the more you're going to be able to thrive in your environment, which is what's so cool. So how does the cortisol awakening response work? We saw the traditional 4-point pattern, and many of you are probably like, yeah, I do that. I already run cortisol. I see the up and down pattern. The cortisol awakening response is a little bit different. So here's how it works. Your brain, the pituitary, is releasing ACTH in pulsatile manner, right? As you get closer to waking up, the ACTH pulses increase. But the adrenals are going, not yet, not yet, not yet. They haven't opened their eyes yet, not yet. So there's a blunting. Now, some cortisol is being produced, but at very low levels because you're asleep. Once you wake up, once your eyes open and light enters into your SCN, your suprachiasmatic nucleus, the blunting releases, your body starts to switch from conscious, meaning your eyes are open, to fully alert. And this happens in about 20 to 30 minutes because cortisol rises sharply. You get about a 50 to 150% increase in cortisol in 20 to 30 minutes. It's your fastest, quickest, most intense rise of cortisol of your day is when you wake up in the morning. So even though we watch these labs of these grand sweeping, in the morning, at lunch, at dinner, and before bed, it's missing the cortisol awakening response, which happens about 30 minutes after you wake up. Now we know, having watched all of these labs, that eventually cortisol should fall down through the day, right? It should start up high, go down so that you can fall asleep at night. So for those of you who are visual, here's a nice little visual to show you when you get the full spectrum sun or light into the retina, into the SCN, this is how it happens. So the real question, this is what they call the flip-flop. Can you flip from consciousness, your eyes are open and you recognize that you're awake, to full alertness, ready to go? The number one question that I ask people when I'm assessing the health of their cortisol awakening response is, how much energy do you have in the morning? Are you alert in the morning? And when people say to me, oh yeah, after 2 hours and 2 cups of coffee, I am good to go. Like, I know that you have a problem with your cortisol awakening response. If it takes you about 30 minutes to get up and get going, get moving, feel like yourself, like really kind of feel alert, you have a healthy cortisol awakening response. But if it takes you several hours, and some people just never get this, a very healthy response, despite the amount of caffeine they take, they're always tired throughout the day. Or the other people who are very hypervigilant, they go from 0 to 100, they go from 0 to anxious, they go from 0 to panic attacks first thing in the morning. Those are the opposite. They have a hyperacting cortisol awakening response. And we're going to talk about that too. Now, why do you care? Other than resiliency and alertness, why do you care how healthy your car is or not? Well, like I said, it affects energy levels. It affects your level of feeling stressed out. It affects blood sugar management. Remember, cortisol is a glucocorticosteroid. Gluco, because glucose is the number one thing that it manages. If you can't get your blood sugar right, you will never get your cortisol right. And if you can't get your cortisol right, you're not going to get your blood sugar management right. So if you have issues with your cortisol awakening response, it could increase your risk for metabolic syndrome and type 2 diabetes. It can affect autoimmune development and progression. I'm going to talk about this. This is probably the most interesting part to me. Once I learned it, it was a huge light bulb effect. It affects inflammation regulation, infection, memory and recall, and cancer outcomes. We're going to talk about all of this. So now that you know this, what I say is, if you can't get your car right, how do you expect to get the rest of your stress response right? If you can't even manage the first 30 minutes of your day appropriately, then it's no wonder that the rest of your day is going to be full of symptoms and issues. My forest analogy is this. You do a traditional 4-point cortisol test. It's like looking down on a forest from a helicopter. You see the whole thing, you miss some of the details. When you add in the cortisol awakening response to the 4-point test, you get the up-close picture of the trees, the plants, the shrubs, the ground life, and the animals. So how is the cortisol awakening response measured? It's very similar to what you're used to. It is done in saliva tubes or saliva swabs, one of the two. It's done in saliva. You collect immediately on waking. So when you wake up in the morning, eyes open, you don't look at your phone. You don't talk to your significant other. You don't snuggle your kids or pet your dog. As soon as you wake up, you either spit in the tube or you use the saliva swab and you put the saliva swab in your mouth. You set the alarm on your phone, 30 minutes later, you do it again. So now you get up, you get out of bed, you start to get going. At the 30-minute mark, you spit in a tube or use the cotton swab. 30 minutes after that, or 60 minutes after waking, you do it again. So it's waking, bang, bang. And that's going to give you a really good idea of what you do at waking, how you climb or not climb at 30 minutes, and then you should be declining at 60 minutes. Now, you want the full cortisol circadian rhythm, so you want to collect around dinner like normal and around bedtime like normal. So these are still really important and they should not be ignored, even though the whole point of this webinar is to focus on the cortisol awakening response. So when you evaluate the CAR, you want to know what the percent rise or change is over your baseline. Can you make a mountain, right? Can you make a sharp, steep mountain, or do you make a rolling hill? Do you make a flat road? Do you go down? Which way does your cortisol awakening response go in 30 minutes? And that'll give you a lot of insight. You want to know what the actual numbers are, and you want to know if you're in the reference range. And in this example, it's the bluish shaded area, because you can have a normal percent rise, but be below the reference range. So it means you have the ability, you just don't have the oomph, and we just have to give you the oomph to get up into the shaded area. Or maybe you have the ability, but you just need more help with cortisol production. Or maybe you've got a cortisone issue. So there's a lot of various reasons. This is why it's important to know percent, actual numbers, and are you in the reference range? So if we step back and look at the whole curve, you're probably going to think to yourself, well, that looks just like a 4-point pattern. It does similar, except look at the circled area. You do it waking 30-30. So it's very zoomed in. Please be aware your morning sample should be higher than your afternoon and your bedtime sample. That's the cut line there, that red line. So your first, second, and third collection should be above your afternoon and your night. It's amazing to me the number of people who come in below the cut line. They start out their day at where they would be maybe in the afternoon or the evening. And they need a lot of help. They have very little resiliency. Now, usually they can tell you that, right? Usually that they're telling you they're tired. They're telling you they're having to drink a lot of caffeine. They're telling you they're burned out. But keep this in mind, your waking, the 30 and the 60 are above the afternoon and the evening point. So let's dive into some benefits of the CAR, because I really want you to understand why I think it's such a really neat part of assessing resiliency. So let's talk about recall. If tomorrow you're thinking back to yourself, what was it that Kerry said in the webinar? I can't quite recall. You have a cortisol awakening response issue. So your CAR is controlled by the hippocampus, and we know the hippocampus has a lot to do with memory. So any hippocampal damage can affect the CAR. Think of like traumatic brain injury, right? The rise in cortisol helps with free recall from the hippocampus, but we also know an exaggerated CAR can damage the hippocampus. We know high cortisol can damage the cells in the hippocampus. So in this study, they found pharmacologic suppression of the morning rise in cortisol has been found to inhibit free recall of previous learned content in text and pictures. Again, if you're trying to remember this webinar tomorrow and you're trying to think, what was it on that slide she had? Your CAR is in jeopardy. And now you know. The CAR and inflammation. How many of your patients wake up in the morning in pain, inflamed, hurting? How many of you have woken up in the morning and thought to yourself when you open your eyes, am I getting sick? I think I'm getting sick. Does my throat hurt? And after about 20, 30 minutes, you're like, oh, nope, I feel so much better. What does the CAR do? The CAR is anti-inflammatory. Chronic circadian misalignment significantly reduced cortisol levels and increased the release of inflammatory factors, including tumor necrosis factor, interleukin, and C-reactive protein. So if you have a healthy CAR and you wake up with that, like, am I getting sick feeling because your cortisol has been low, by the time your CAR kicks in, dampens all the inflammation, dampens the infection, and you're good to go. Cortisol, as we know, is anti-inflammatory to a point. So ask your patients, do you wake up with pain? Do you wake up inflamed? Do you wake up feeling sick? And does it last all day, or does it, go away after 20, 30, 40 minutes? In the periphery, glucocorticoids are critical for downregulating the inflammatory response to pathogens and their toxins. Induced by cytokine stimulation of the Hpa axis, glucocorticoids potentiate the acute phase response while acting in a negative feedback loop to suppress further cytokine production. So if you didn't know this already, your glucocorticoid release helps keep your cytokine production in check. It's like a checks and balances, which is really wonderful. But if you don't have your cortisol, if you have low cortisol, too low, then you're going to have excess cytokine production. What about autoimmune and the car? This is probably my absolute most favorite pearl that I learned about the cortisol awakening response. I learned about it from my immunology professor in medical school, Dr. Heather Zwicky. So glucocorticoids are strong inducers of apoptosis in the thymocytes. So I have it all diagrammed out for you here on the slide, but I'm going to walk you through it in a basic analogy as I understand it, so it's easier to understand. When you're a T cell, you're an immature T cell, you get sent to the thymus gland, right? The thymus gland has all the tissue, has all the tissue in your body, and it runs the T cell through it to see if it's going to be autoimmune or not. It's called central tolerance. So you're a T cell and you go to the thymus gland, and the thymus gland goes, all right, I'm going to run you through all of this tissue and let's see if you react. If you react to self-peptide, let's pretend to the thyroid gland. The thymus gland is going to go, oh, I'm so sorry, you failed. You're going to increase their Hashimoto's either risk or their current Hashimoto's. You're going to make it worse. We're going to pull you aside and we have to kill you. You can't be a self-made T cell that's also reactive to self. Like, that's failure. So we're going to pull you aside and kill you. What triggers the killing, the apoptosis of those failed T cells is the cortisol awakening response. So if you have a low or a flat cortisol awakening response, then your risk for autoimmune increases, or your risk for autoimmune symptoms, if you already have it, or development, because the failed cells aren't killed. And in my head, T cells are sneaky and they just sneak out, right? No apoptosis is happening to the degree that they want, the thymus gland wants it to. And so they slip out and circulate, causing problems. What about cancer? Cancer and a flat slope. So there's good research to show that if somebody has cancer, in this example, it's breast cancer, that if patients with a flattened diurnal cortisol pattern had earlier mortality. So when we're looking at a cortisol awakening response and it's flattened out and flattened through the day, and they have a history of cancer, I know, unfortunately, they could have an earlier mortality, and I'm going to work really hard to get their circadian rhythm back to being high in the morning and low at night. So let's check out some CAR examples. We're going to talk about elevated CAR and we're going to talk about low CAR. Both of these examples I talk about all the time because they are practitioners. Both of these are doctors who have given me permission to talk about their case because they are both independently help people understand how important this is, and practitioners heal thyself. So the practitioner on the left reported that she wakes up in the morning with a super busy to-do schedule. Her phone immediately is going off. She's trying to get her family out the door. She runs a busy clinic, a very large busy clinic. And she says, as a result, my anxiety goes through the roof. She goes, I wake up 0 to 100 and I can't come back down. And then I have a lot of exhaustion. I feel very tired in the afternoon. I feel like I've crashed. And I looked at her car and I said, yeah, of course, you're waking, the highlighted area, your waking is borderline low, and then you shoot up and you keep going up at the 60-minute mark. So you go up, up. No wonder you feel anxious, panic, stressed as you go through your morning. Then you fall down into the afternoon. And even though her afternoon is completely normally in range, that's a big fall, right? That's a big drop. She pretty much fell off the mountain from her morning 60-minute point until her afternoon point, as opposed to falling off more of a gentle hill. So no wonder she feels tired. Practitioner on the right says to me, Kerry, I wake up and I need at least 8 cups of coffee to get going. I asked her if she was joking. She said she was not. 8 cups of coffee to get going, and she still felt dead throughout the day. You can see on her highlighted pattern, where the 3 red arrows are, she wakes up low, then she's low, and she continues to be low. I'm concerned for her, not only about her resiliency and her alertness and her energy, but her autoimmune. If, God forbid, she should ever develop cancer, I'm concerned about mortality. I'm concerned about memory in both of them. I'm concerned about inflammation and infection with this flat CAR. And so she has a lot of risk that we need to work to get her CAR up. So let's start with the elevated CAR and what you can do for that. So first things first, when your patient tests or when you test, talk with the patient about if anything unusual happened that morning. Why is their CAR high? Did their dog throw up? Did they wake with the flu? Did their kid get sick? Did they get a really scary text message as soon as they woke up? And if that's the case and that's not their normal, advise them, if these things happen, maybe don't test the car that day unless you want to see what your car looks like when you're challenged. Now, on the flip side though, if they always have this happen, if they're like, well, if it's not one thing, it's another in the morning, then tell them to go ahead and test because it's their normal. So why would they have high CAR in the morning? Anxiety, panic attacks on waking or close to after waking. Depression, not seasonal affective disorder. Depression is not caused by a high CAR per se, but we know that cortisol can divert the creation of serotonin down the kynurenine pathway, and therefore can lower serotonin in the morning. So it's called melancholic depression, worse in the morning. It can be very cortisol serotonin related. Keep that in mind. Anticipatory stress for the day, like the doctor who is a family and a full clinic that she's trying to work on, her anticipatory stress for the day was huge. Waking up in acute pain, inflamed or infected. Like I said, stressful event happens first thing in the morning, but is this their normal? Did they drink caffeine or take stimulants first thing in the morning? Some people set their coffee maker, to go off when their alarm goes off, and then they have coffee ready for them. Some people have significant others that bring them coffee in bed, bless their heart. And so just let them know, like, please don't do that on the morning of testing. Please don't drink your coffee until, well, really, ideally, not the whole day of testing, but at least wait until after the CAR portion. And then ask them where they were in their cycle. Ovulation. Research says at ovulation, there's a higher CAR. And they suspect the reason for that. At ovulation, everything goes up, right? FSH was up, then estrogen goes up, then LH goes up, then progesterone's going up. And so ACTH and cortisol just gets in the mix and everything goes up. So it could just be situational with ovulation. Whatever you do for elevated CAR, consider doing any high cortisol suggestions within 30 minutes of waking for maximum impact, and always address their sleep. Sleep and circadian rhythm are huge. Sleep and circadian rhythm will probably fix a lot of the CAR issues. And we know so many of our patients and so many of ourselves do not have very good sleep habits. But whatever you give them, whatever supplemental plan, give them within 30 minutes of waking. So how do you address an elevated CAR? Now, in the interest of time, I'll give a lot of these just for resource purposes, and I'm not going to go over every single one. And thankfully, you have AOR is a great reference to talk to about some of these products and some of these ingredients. But let me just run through some of the basics. So how do you address an elevated CAR? Talk to them about meditation, breathing work, journaling, yoga, especially in the morning, heart math, respirate, vagal nerve exercises, things that increase oxytocin and reduce cell phone or EMF exposure. So advise people to, if they sleep with their phones, put it in airplane mode and not, turn off the Wi-Fi at night to their tablet, to their computer, whatever they have in their bedroom. What stimulates the vagus nerve? Lots of stuff. I'm a big fan of washing my face with cold water, ending my shower in cold water. I listen to music all the time. So singing, laughing, chanting, humming, but you have to do it loudly. You want that vibration. Tell them to get up and gargle. Be like, hey, look, in the first 30 minutes, I want you to splash cold water on your face and gargle some water. Valsalva maneuver is an option, not my favorite one, but meditation on waking, very popular. And for people who get overwhelmed with meditation, I'm like, just pick an app that does 5 minutes. Just do 5-10 minutes of meditation. Anything that addresses the gut, yoga, rhythmic breathing, and laying on the right side. What increases oxytocin? This is a plug for my dog. That's my dog in the picture. His name is Hank, and he is my biggest source of oxytocin. As much as I love my husband, I actually even told him last night, babe, I'm sorry, but the dog brings me more joy. He just has that unconditional love and that face. So what increases oxytocin? Physical touch, hugging, kissing, cuddling those you love, including pets, words of encouragement and appreciation. So to everyone who is listening to this webinar, I really appreciate your time, and I think you're doing an awesome job. So there, I just raised your oxytocin. Meditation and prayer, eat, drink, and be merry with your friends, and of course, breastfeeding. Now, we have a number of supportive supplements, and these I'm just going to breeze through. This is more of resources just because of the interest of time, but I wanted to make sure you had all the information and the studies that went along with them. So Gaba Support, right, you can do Gaba itself. It's not thought to cross the blood-brain barrier. There is some research, which I believe I have linked somewhere. It does act via the enteric nervous system. So if you take Gaba and you feel calmer, while it could be a leaky blood-brain barrier, it could also be your enteric nervous system via the vagus nerve going up to the brain saying, make Gaba, which I thought was very cool. Pregnenolone creates ALLO, A-L-L-O, that supports GABA A receptors. We get into the amino acids like L-theanine, 5-HTP, tryptophan, and taurine, which is not really a true amino acid, which is why it's in parentheses, but very calming nonetheless. You will see on some of these I have BDNF listed, brain-derived neurotrophic factor. Love increasing BDNF. Some of the BDNF ones have question marks, not because they don't necessarily, but because the research is not as robust as others. L-theanine has a lot of research on BDNF. When it comes to 5-HTP, please remember not to deplete dopamine. When you give 5-HTP, or tryptophan or 5-HTP, but not tyrosine or L-DOPA, remember the rate limiting step is this enzyme. They both convert their respective precursors into serotonin or dopamine. So if you're just giving lots and lots of 5-HTP, you could be doing it at the detriment of dopamine, and vice versa. If you're giving somebody tyrosine or L-DOPA, you could be doing it at the detriment of serotonin. So just keep that in mind. We don't want to deplete either of those. Calming herbs, magnolia, one of my absolute favorites. Ziziphus, which is known as jujube, and skullcap, another big favorite. All of these, right? Calming, anxiolytics, really helpful for reducing cortisol. Chamomile, avena, passion flower, maca, and then hemp-derived CBD. Big topic, requires a separate lecture, but you can do your own research. Adaptogens, we have ashwagandha. Here's where you'll see with the BDNF question mark. It's not necessarily that it doesn't, it's just that research is more robust than some of the other things without the question mark. Eleutherococcus, rhodiola. One of the things I like to point out about rhodiola, please be careful, is rhodiola can be stimulating to some people. So if they already have a high CAR, at high doses, it could be very stimulating and cause anxiety. Rhodiola is also drying, so be very careful to your menopausal woman who has dry eyes, dry mouth, dry vagina. You just may want to be aware of that. Now, if she's menopausal with night sweats, rhodiola might be really good for her. And then holy basil. Holy basil is probably my favorite. Just personally, I take holy basil every single night before bed. And then we have the citations there. Cordyceps, huge fan of cordyceps, Shishandra, and Bacopa. Bacopa is rapidly becoming one of my favorites because of its effect on the brain. Brain inflammation, BDNF, cognition, hyperactivity, and improving hyperactivity and attention. You're starting to see it in a lot more products, specifically like AOR. And I love that because when we're really dealing with the Hpa axis, we're dealing with the brain down, right? And so we've got to really focus on that brain. And then I have the citations for that. Let's flip and look at the low CAR. And again, remember, like I said, in the interest of time, I'm making sure to pack the slides, which so that when you're watching this or you get the slides or you get the replay, that you can have all the information and the citations right there, more of a resource. So low CAR consideration, same thing. If you see it low on test, ask the patient about the morning of collection. Did anything unusual happen in the morning? Did they forget to collect? It's amazing when you tell a patient to do something and they do the complete opposite, like, hey, it's really important that you collect this on waking. Don't look at your phone, don't do all these things. And then your patient calls you in a panic and they're like, oh, I forgot. I got sidetracked. I was doing something else and I didn't collect my first collection until an hour after waking. No, they have to repeat it. Consider there might've been a situation. So did they sleep in? Did they, it was on a Sunday and they decided to sleep in. So they kind of like woke up, went back to bed, and then they missed their CAR. Forget to collect it, they look at their phone, like I said, and then just, really strongly let them know we may have to repeat the test, or just don't test if you can't, if you're not going to, follow these instructions. So why would somebody have low cortisol awakening response? Excessive amounts of psychological burnout, sleep deprivation, sleep apnea, disordered breathing, anything sleep related is 100% going to affect the cortisol awakening response. Traumatic brain injury, or any damage to the hypothalamus or the pituitary, and any damage to the hippocampus. And like I said, the hippocampus is what controls the CAR. Chronic pain, you have that feedback loop kick in, and you have HPA down regulation. And how many of our patients report chronic pain? So many of them. PTSD, post-traumatic stress disorder, seasonal affective disorder, poor HPA communication in general. So if the brain, for whatever reason, maybe it's blood flow, maybe it's, they've got a bunch of, tight shoulders, tight neck, things going on, and they just can't get down to the adrenal glands. Maybe they've had a lot of abdominal surgery with a lot of scar tissue in the abdomen, and therefore blood flow around the kidneys, around the adrenals is really tough. Fluorescent lights we're going to talk about, and suppressive medications. These will all lower your cortisol. Speaking of suppressive medications, it's amazing what patients don't tell you. Even though you don't recommend or prescribe these medications, they forget to tell you that somebody else did, or they take them every day, and to them, they think of medications like an antibiotic, right? So they're thinking, well, no, I'm not on any medications, and yet they forgot to tell you that they take a steroid nasal spray or a asthma inhaler pretty much every day. So steroid medications, inhalers, nasal sprays, oral pills, topical creams, even injectables, joint injectables for steroids will suppress cortisol. Now, if somebody needs an inhaler for their asthma, and they use it once or twice, not such a big deal. But when they tell you they're using their inhaler every day or 5 times a week before they work out, it could affect their Hpa axis. Same for nasal sprays. Think of like allergy. Allergy season is a big one for nasal sprays. Opioid medications. We have an opioid epidemic here in the United States, and it's amazing to me the number of people that casually take opioids and think nothing of it. They have them left over from their surgery, their spouse's surgery, their sister's surgery, their kid's surgery, and they're like, oh, I have a headache. I'm just going to pop this opioid really quickly, or my back hurts, or I tweaked my knee when I went for that run. I'll just take this leftover pill. But if they're doing it enough, if they're treating it like something over the counter, such as ibuprofen or acetaminophen, which I'm not saying those are great either, but they don't affect cortisol the way that opioids do. And it's amazing to me the number of patients, who will admit they're doing opioids more than you think. Accutane, which is isotretinoin, that's for acne. There is mixed research on this. I found this out through another practitioner of mine who had a patient who looked at Addison's. The endocrinologist was a lot more on the functional spectrum, said to the patient, I think it's from your Accutane, let's stop your Accutane and retest in 3 months. There's some research to show that Accutane is affecting the cells of the hypothalamus. Sure enough, after 3 months, her cortisol came back and she no longer looked Addison's. She did not have Addison's. That's what the endocrinologist couldn't figure out. Looked it, didn't have it. I have subsequently looked on PubMed and other research places for research on Accutane. I have one listed there. It's mixed. Some say has no effect on the hypothalamus or the pituitary. Others are like, yep, it permanently kills some of the cells. Sorry about your luck. And definitely, since I have been lecturing about it, I have had a number of, people come up and tell me, oh my goodness, I have never been well since. Or when I took Accutane, I was a mess. I was depressed, I was tired, I was not myself. And when I came off the Accutane, it got a lot better. So something to keep in mind and ask about the history of, do you have a history of Accutane? Do you take Accutane for acne? Some people will just do one course, and some people were on it for 2 or 3 years. It's really eye-opening. Aspirin, in some research, says it suppresses ACTH. Other research says it does not. So just be generally aware if they tell you they're doing aspirin every day. It could be really concerning. In the research article I have listed here, trying to see which one it was, they gave a 600 milligram dose of aspirin and saw that it did suppress the Hpa axis. So that was one time, I believe it was 600, not 400. It was a big dose, and they just gave it one time. And so I sort of have been thinking and trying to track and follow, if people are doing a one-time big aspirin dose, let's say they hurt themselves and they just, take aspirin, as opposed to people who are taking the baby aspirin or even, adult aspirin every day for cardiovascular health, how is that affecting it? We don't know yet, yet to be determined, but just keep that in mind. Remember the cortisol feedback loop in general. If somebody has high cortisol over time, the feedback loop will tell the hypothalamus and the pituitary to shut down production of CRH and ACTH, and as a result, cortisol will drop down. So in your patient with low cortisol overall, ask them about their history, as we do, to say, did you used to have high stress? Did you used to have high cortisol? Have you been tested before and your cortisol is high? And if it was, and now it's low, I would suspect this feedback loop. Okay, low CAR. Consider doing any low CAR or cortisol suggestions within 30 minutes of waking for maximum impact, and always address their sleep. Same thing, the CAR happens in about 30 minutes, right? So whatever you do, whatever you recommend, whatever you suggest, whether it's meditation or supplementation, suggest to them within the first 30 minutes of waking. Because what happens is you give somebody something to take in the morning, and what do? They get up, they get ready, they have breakfast, and then they take their supplements, or they drive to work and then they take their supplements, or they forget and they take them in the afternoon. And by then you've missed the cortisol awakening response. We're trying to retrain the brain to have a proper cortisol awakening response. So lifestyle, start with the brain always. HPA retraining, which is my phrase, it's not a medical term, but basically what we're doing is we're trying to get the car up in the morning and then down at night. Using adaptogens, nutrients, and brain support, consider light therapy immediately on waking for the car when it's low. So think of the sun or full spectrum lights, and then light movement or exercise on waking. Go outside, get some fresh air. So if it all starts with the brain, follow a strict circadian rhythm. Be really clear with them about your sleep hygiene, as I know that all of you are when you're talking with your patients. Get their gut healthy and work on the vagus nerve. Improve blood flow and oxygen to the brain. How do you improve blood flow and oxygen to the brain? You're going to look at things like exercise. Of course, you're going to talk about smoking cessation. You're going to optimize their blood sugar. You're going to consider things like neurofeedback, biotuning, craniosacral work, energy medicine, anything that's going to help brain health. Acupuncture, chiropractic massage, all those people who have tight upper back, they've got their shoulders up to their ears, their neck is stiff, that is affecting brain flow and oxygenation up and down to the brain. And hormones, as we know, rides around on the circulatory system. So you are essentially clogging up the highway if you have tight muscles and you've got a lot of misalignment. So go get that fixed. Also consider things like hyperbaric oxygen therapy, HBOT. Really wonderful, of course, it's being used post-traumatic brain injury, but can be used in general for just hormone support, cortisol support, just overall health. Look at iron overload, known as hemochromatosis. Iron deposits can affect brain function. And there was a study, this is a rat study, but they found that when they turned a phone on with rats in a cage and left it on talk for 6 hours a day for 2 months, that it increased considerably the vacuolation in the brain, which is the ability of your brain to try to clean up the mess, to try to clean up itself. And it's because a lot of damage was happening. And we know that cell phones increase brain temperature. And so I know this was a rat study, but just be very careful. There are some people that we know in this world that have their cell phone up to their head 6 hours a day or around their head 6 hours a day. And you just want to be careful. And the citations for that. So if it all starts with the brain, a lot of these supplements are similar to the high CAR. So Bacopa now moves to number 1 because we're trying to stimulate the brain to stimulate cortisol. We're trying to get everybody back on track. Cordyceps, omega-3 fatty acids, and rosemary, one of my favorite, quote, according to this, has cognitive enhancing powers. We could all use a little cognitive enhancing powers. So go out and smell your rosemary, use your rosemary to cook, drink your rosemary tea, have some rosemary, because use the rosemary essential oil because it can be really helpful for the brain. Rosemary also increases acetylcholine, which is probably my favorite neurotransmitter, but rosemary will suppress iron absorption from the gut, so be careful of that. Ginkgo, a lot of talk about ginkgo for recall, recognition, reaction time, attention, raises BDNF, and then PQQ. PQQ is often paired with CoQ10. It increases nerve growth factor, protects NMDA receptors. It is an antioxidant to peroxynitrite, which is huge. So that's really good for your mitochondria. It reduces C-reactive protein and reduces IL-6. My understanding, I don't use PQQ as much, but I have a lot of colleagues who sort of cycle PQQ. They won't use it continuously, but they'll sort of cycle through it. But they'll use like Bacopa, PQQ, and CoQ10 for a lot of brain stuff. All right, getting sun or full spectrum light exposure first thing on waking. So I tell people, I know you're tired, I know your car is flat or low, but I want you to at least open up your blinds, open up your curtains, and go back to bed. So lay in bed and just at least get the full spectrum exposure. If you do have the energy, go outside. I want you to go outside for 10 to 15 minutes and get that full spectrum exposure. Now, don't stare in the sun. Let's not burn out our eyeballs. Be smart about it. But at least go outside. And if you can go outside, just stand there. And if it's, a nice day and you have a dog, go outside and walk your dog, just 5 or 10 minutes, 15 minutes, get that light movement, get that light, and that will make a huge impact on the car. Now, if you don't have you don't live in an area that the sun is out, like currently where I am sitting, in Portland, Oregon, it's gray and rainy. And so I have a full spectrum light box. And so that's what I tell people. If you don't have a lot of sun exposure, just get online, read the reviews, and buy a full spectrum light box that's on your counter so that when you wake up in the morning, you can turn your full spectrum light on. I actually have mine in my kitchen because when I get up in the morning, my husband and I sometimes get up at different times. And so and for some reason, my dog likes the way I do things better than him, which is probably why I love him so much, because I'm his favorite. I will get up and I will let the dog out, and I will stand at the back door and get my full spectrum exposure out the back door, unless it's pouring down rain, which is common. And then my back door and my kitchen are in the same area. So then I will just turn on my full spectrum light while I am feeding the dog, getting water, making tea, what have you. And then I will just leave it on while I'm working in the kitchen, doing all of those things. And it's wonderful. It's made a big difference. So when it comes to light, when you're reading research, you have to be very careful about the kind of light that they're using. So in this particular article that came out in 2010, I was reading about how all the light, the 5,000 lux and 10,000 lux, 800 lux, all affected in a positive manner cortisol. And I get down to the sentence in red: acute suppressive effect on cortisol following bright light exposure, 10,000 lux of white light for 6.5 hours. And I thought, wait, why? No, how come I have other green stuff highlighted where it's positive and this study was not positive? So I pulled the study and I read the kind of light that they had, and it turns out they were using fluorescent lights. And you can see there, lighting was generated using ordinary commercially available ceiling mounted. Now they're broad spectrum fluorescent lamps, but let me show you the difference. So here's a picture, just give you an idea. So we have daylight, sunset, LED, and incandescent. You can see in daylight, it's blue dominant. In sunset, it's red dominant. In incandescent, it's red dominant. LED is more blue dominant. And then we have broad spectrum fluorescent. So there's warm and there's cool. And it doesn't exactly look the same. Warm and cool don't exactly look like daylight, sunset, LED, or incandescent, do they? So even though it says the word broad spectrum in there, you have to be careful. And I'm sure a lot of you know what it's like to be under fluorescent lights for long periods of time. We've all been in big stores. We've all been in conferences where they use fluorescent lights. And by the end, we're kind of tired and we're kind of, over it, and we're kind of brain dead by the end. And it's entirely possible some of that has to do with the fact that they're using fluorescents. Adaptogens, ashwagandha, Siberian ginseng or eleuthero, rhodiola, which we've talked about. Adaptogens, of course, can be used for high or for low. With rhodiola, again, it's stimulating, so you may want to use higher in this situation, higher doses. Cordyceps, Shishandra, and again, Bacopa. Panax, much stronger, good tonic for the completely exhausted. When you read the older herbal books, or even in the newer herbal books, they all talk about Panax and how it's wonderful for the completely exhausted, the completely burned out. It could affect glucose over time, so be careful of that. It increases acetylcholine, which again is my favorite. It's anti-inflammatory, and it can be heating and stimulating. So I have had a few menopausal women who it did increase their hot flashes and night sweats. It was just too much for them, and it could have been the dose that I had them on, so I just switched it. Panax does raise BDNF. And then we have licorice, of course. Licorice, what it does is it inhibits, it strongly inhibits 11-beta-HSD2. That is the enzyme that deactivates. It deactivates cortisol to cortisone. So it deactivates that enzyme so that you just keep your cortisol around as cortisol. Now, be careful. You have to watch for hypertension and you have to watch for hypokalemia. And you have the citations for the adaptogens. So in summary, the CAR has a lot to do with resilience, your stress, blood sugar, inflammation, autoimmune, mood, and more. Collection does require 3 saliva samples, whether it's the salivettes, the swabs, or the free-flowing saliva, in the first 60 minutes upon waking. Treatment considerations are not difficult, but timing is absolutely everything. So please remember to try to impress upon your patients or yourself, when you want to affect the CAR, you want to try to do it within the first 30 minutes of waking. Now, I know a number of you are going to say, my patient is on thyroid medication. That's when it gets a little trickier. Some things you can do in the morning within 30 minutes, right? You can take your B vitamins, you can take your vitamin C with thyroid medications. Some of the herbs, I'm doing some research now. I'm in the early stages of trying to figure out what herbs are safe to take with thyroid and what herbs actually have stuff in them, compounds in them that would inhibit thyroid absorption. So I am starting to work on that. But I fully understand, I know thyroid medication can be the one caveat for people when it comes to this. Treatment, let's see here, vagal exercises daily with an overstimulated Hpa Axis. So when they get up in the morning, if they meditate, but also have them splash cold water on their face, if they get up and immediately get in the shower, and their shower in cold water, play some music, hum, sing loudly, get the vibration going in their throat. Remember sun or full spectrum light exposure daily in the morning for circadian rhythm. Go outside, go for a little walk, use a light box. Get off the phone, the computer, the tablet at night, unless of course you're watching this webinar. If you're watching this webinar, hopefully you're wearing blue light blocking glasses. And like I said earlier, proper sleep will probably fix about 50% of your car issues. Lastly though, pet a dog. Pet a dog because that's going to increase your oxytocin. It's going to reduce stress. It's going to induce the parasympathetic happiness and joy. Now, of course, make sure you like dogs and it's a nice dog and you're not allergic to dogs. So there are some caveats. But if you pet a dog, pet all the dogs, you're going to induce all of these things and it's going to help your stress response, your resiliency, and your adaptability. I'm fully convinced of it. So thank you everyone for listening. That concludes our talk. And if there are questions, I will open up the control panel and see where it comes to questions. If anyone has questions, I'm happy to answer them. Let's see. Actually, I don't think I have access to questions. Oh, wait, I do. Paul, are you there?
Yes, I am. I think there were a couple. We try to answer them throughout. Any recommendations for sleep specifically?
For sleep specifically, so sleep depends on obviously a lot of things. It depends, is it cortisol? Is it high cortisol? Is it because you have low melatonin? Is it because it's a blood sugar issue? Is it because you have gut issues? There are a number, is it because the people you sleep with, you co-sleep? Does your partner snore? I mean, it could be a lot of reasons for sleep in general, but I'm a huge fan of the magnesium threonate at night before bed. I'm a big fan of phosphatidylserine. I am a big fan of like California poppy and skullcap and passion flower. So all of those calming things before bed. Big fan of course, like I've been talking about, all the circadian rhythm things. So winding down at night. Oftentimes what I will find is practitioners will use their nighttime because they get a second wind or because their family has gone to bed. And so finally they're like, yay, I have time to myself. And so then they will work from like 9 to 11 or, 8:30 to 11. And then they'll shut their computer down and they're like, well, now I need to go to bed. Like, well, good luck trying to switch your system. So if you're going to do that, at least try to wind down, at least wear your blue light blocking glasses. So when it comes to sleep, there are a lot of things that that can be done, that can be used.
Okay, do you see this next one? What if somebody has a low morning cortisol but extremely elevated CAR and they wake with severe chronic pain due to autoimmune disease? Total DHEA and cortisol are high on the Dutch and DHAS is low, night cortisol is high.
I don't see that one. Wait, hold on. I think all I can see is the chat. Is there a difference between chat and questions?
Yeah, I think there is.
Okay, you have to read it to me again. Sorry, because I was looking to see if I could just read it.
That's okay. So low morning cortisol, but extremely elevated CAR, and they wake up with
Like
chronic
low
pain.
waking?
That's what it says.
Okay, so low waking, and then the 30 and the 60 are high?
Yeah.
Okay, yep. And then keep going, sorry.
And then total DHEA and cortisol are high on the Dutch, and then DHEAS is low and night cortisol is high.
Well, we don't test DHEA. We only test DHEAS, and then the metabolites, etiocalanolone and androsterone. So total DHEA you said is high, but DHEAS is low?
You're correct, yeah.
Okay, and then but then with a high CAR, but waking up with a lot of pain?
Yes.
And then they're asking like, what do I do?
Yeah, well, yeah, I guess, where do we start with that?
Oh, pain. You have to address the pain. This isn't a cortisol issue. This is a pain issue. This is an inflammation issue. And the reason I say that is if you're waking up with a lot of pain, like I said, acute pain can drive cortisol up, right? Cortisol is trying to help you. So if you suppress the cortisol, it's entirely possible your pain could get worse. Now you can try it. You can try suppressive things in the morning. You can try, like phosphatidylserine in the morning. But what I've experienced is that sometimes people get worse because the cortisol is actually trying to help them. When it comes to DHEA, when the DHEA-S, the sulfated form, is lower than the other androgens, so the etiocalanolone, the androsterone, the testosterone are maybe in range or even high, compared to the DHES, inflammation is the #1 reason. Again, inflammation lowers sulfation. It stops the enzyme from putting the S on DHEA. So what that often means is that the DHEA just goes downstream to the other things. So you don't have a DHEA production problem. You can make DHEA, you have a sulfation problem. And the sulfation problem is, just based on the limited information that person gave, probably due to the amount of inflammation they're under and pain that they're in. So I would focus on that, the inflammation and the pain, and then come back to the Hpa axis. I will say when I see DHEA elevated, I don't freak out. I don't worry. DHEA, if I had to pick a favorite sex hormone, I would pick DHEA, just like I chose acetylcholine as my favorite neurotransmitter. And the reason for that is DHEA is so protective against the damaging effects of cortisol in the brain. It raises BDNF. It raises acetylcholine. Now, I understand DHEA can cause acne and hirsutism and male pattern baldness and all these things if it's going down the 5-alpha pathway. But I don't rush to lower the DHEA because I think the DHEA in my research is actually protective. So if you're inflamed and in a lot of pain and you're setting off the Hpa axis, which is trying to protect you, and then you set off DHEA, which is trying to protect you from the effects of the cortisol, then your body's trying. Your body's trying. So I wouldn't necessarily affect I wouldn't suppress the Hpa yet. I'd affect the inflammation and the pain. That's where I would go. And then at night, you said I think you said the cortisol was high at night. So all the things I said before. And again, if you have pain at night, then we know what the issue is. But if it's not pain at night, if it's stress or blood sugar or something like that, then you can address it.
Awesome. Thank you so much. I think that's everything on the questions. That was an awesome webinar. I'm going to turn it over to Dr. Neerat Nibber, who'll just say a few closing words. But thank you so much from us, and I look forward to collaborating.
Yeah, absolutely. Thank you so much. This was wonderful, and I hope everyone learned a lot. And if you do have questions, please definitely feel free to reach out to AOR or to reach out to myself, and we'll get them answered.
Yeah, thank you. This is Dr. Neerat Nibber. I'm a medical advisor at AOR, and I just wanted to thank Dr. Jones. That was incredibly insightful, and you make information so accessible. So if anyone does have any additional questions, you can email them to marketing@aor.ca. That's marketing@aor.ca. And we have another professional exclusive webinar coming up on March 26th at noon, which Dr. Paul will be presenting on clinical pearls and root causes of chronic pain. So if you're not registered for that yet, you can sign up at aor.ca. Thank you again for taking the time to listen. This will be available and emailed out to you shortly. And we hope you have a wonderful day. Bye-bye.